Successful team dynamics are critical during a resuscitation attempt. The interaction among team members has a profound impact on the effectiveness of each individual's performance, as well as the patient's survival. The better you work as a team, the better the potential outcome for your patient. That's why it's so important to understand not just what to do in a resuscitation attempt, but how to communicate and perform as an effective team, regardless of your role as team member or team leader. To appreciate good team dynamics, it helps to understand what happens when team dynamics fail. Let's watch the following example of poor team dynamics and see if you can spot the areas that need improvement.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
We've got a teenage boy in full arrest here.
8, 9, 10. Watch out, watch out! Move him over. All right. Stop, stop, stop. He's still strapped to the cot. All right. Move on 3. Ready? 1, 2, 3.
When we got there, he just said he wasn't feeling very good.
Let's go ahead and hook him up to the monitor.
We need to ventilate.
We've already shocked him twice, once about a minute ago.
1,
We need to get an IV started.
Have you shocked him? 6.
Yeah, last time
8,
a minute ago.
James, take over compression.
11. Okay,
I'm
I've
fine.
got it. Hey,
I'm
I've got
fine.
it. I got it.
What have you done besides shock?
Just basic life support.
Laura, can you take care of that IV?
Okay.
Who's documenting? Kayla.
I'll get on it.
The scenario you just watched presented some serious communication flaws, the kind of flaws that can derail a resuscitation attempt. Successful teams not only have medical expertise and mastery of resuscitation skills, they also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Let's review those now, starting with roles. Clear roles and responsibilities should be immediately established. When all team members know their jobs and responsibilities during a resuscitation attempt, the team functions smoothly. The designated team leader should clearly define and delegate tasks according to each team member's area of competence. Every member on the team should know his or her limitations, and the team leader should be aware of them. Team members should ask for assistance and advice early, not when the situation deteriorates. Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague before he or she makes a mistake, whether it's a drug, dose, or intervention. The next category is what to communicate. Knowledge sharing is a critical component of effective team performance. Team leaders should ask for good ideas for management and frequently ask for observations from team members about possible oversights. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and the team's progress within the algorithm of care. This technique can also help team members respond to the patient's changing condition. The last category of team dynamics is how to communicate. Closed-loop communication is important for both the team leader and team members. When the team leader gives an order, the team member should confirm that he or she heard and understood the order. The team leader should call people by their names and, if possible, make eye contact to ensure that the team member has understood the order before assigning additional tasks. The team member should tell the team leader when he or she has completed the intervention. Team leaders and members should also use clear messages. Using concise, clear language helps prevent misunderstandings. Speaking in a tone of voice that is loud enough to understand, but also calm and confident, helps keep all team members focused on the task at hand. All team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. Because emotions can run high during a resuscitation attempt, it's especially important that the team leader speaks in a friendly, controlled voice and avoids shouting or aggression. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and deficiencies to light. Implementation of debriefing programs may even improve patient survival after cardiac arrest. Now we'll see the same scenario with everyone using good team dynamics. See if you can spot each key element in use.
Hi, everyone. EMS just called in and said they have a 16-year-old male who arrested in their unit as they were arriving. They're unloading now, and Pam is meeting them in the ambulance bay. She'll ventilate when they arrive. James and Aaron, can you two cycle through chest compressions for the first rounds? James, you're first on compressions, and Aaron, I need you to hook them up to our monitors and defib.
Yeah, I'll start on compressions.
And I'll have monitor and defib.
Okay, good, thanks. Laura, can you take IV and meds?
Yes, I'll take IV and meds.
Kayla, I need you to record.
I'll record.
Great.
Hi, we're a VLS crew with a 16-year-old male here. Witnessed cardiac arrest precisely 3 minutes ago. We started compressions, applied our AED, and gave one shock with no RUSC. We then gave a second shock at the 2-minute mark with no change that we could see. He has been easy to bag.
Okay, thank you. Let's move him over at 30. 28, 29, 30. All right, 1, 2, 3.
Okay, Mike, I'll take over compressions.
All right, thank you. Good switch. James and Aaron, you can swap out compressions every 2 minutes or sooner if you get tired. Okay. Do we have an IV?
No, I'm working on the IV now.
Laura, if you can't get the next to stick, try an IO.
I'm recording.
Okay, monitor is attached.
Hold compressions. I do not feel a pulse. He's in PEA. Continue CPR.
Okay, IV is in and flushed.
Good. Kayla, can you provide a summary of the action so far?
We've inserted an IV and attached a monitor.
As you've just seen, designating team roles and good communication allow for a rapid and orderly response in an emergency situation. Clear direction and effective communication by all team members create an environment where patients have the best chance of survival. You'll now have a chance to discuss the elements of good team dynamics that you observed in this scenario.